Some of the medical institutions and facilities in Nigeria predate the country's independence in 1960. However, despite improvement in some of the infrastructure and expanded medical services, human and material resources, particularly cutting-edge equipment, remain inadequate. For those who were around before or few years after Nigeria's independence, the experience of the country's health system is one that is nostalgic.
When I was in the university at that time, under 12, children who are under 12, and pregnant women, those who have cancer, those who have tuberculosis, they were receiving treatment free in this country. At that time, the health system was so good that some of our teachers were from developed countries. UK, the Canada, Australia, they were teachers. And they were comfortable here to teach here. And even those of our resident doctors who will go on 1 year abroad then are coming back home because our system here was good enough to take care of them. Even the pay was comparable, and therefore they had no need to stay over there.
The pace of growth and development in Nigeria's health sector is at variance with the country's growing population. With an estimated 198 million people, the ratio of 1 doctor to 600 people recommended by the World Health Organization is far from being achieved, as it is said that there are just about 45,000 medical doctors practicing in the country.
You see a state build a big general hospital and employ only 1 doctor there. How is it going to cope, for God's sake? So, employment opportunity is not even there for the doctors. The government has refused to employ doctors who we are training, and yet we are not enough.
1 in 15 Nigerian children die before reaching age 1, and 1 in 8 do not survive their 5th birthday. Maternal mortality ratio is put at 576 per 100,000 live births, while only 25% of children aged 12 to 23 months get full immunization.
What we have done is to put in place measures that will now begin to reverse this trend in terms of intense programming, declaring a state of emergency around the number of unimmunized, some 4.3 million kids unimmunized across the country.
In the Western world, medical research plays a major role in the formulation of health policies and the control and prevention of diseases. The question to ask is, how much of medical researches are being carried out by Nigerian researchers in the country?
In the past, the Institute was involved in the surveillance of yellow fever, when we used to have frequent outbreaks of the disease. The first HIV disease in Nigeria was diagnosed at the Institute. We do have pockets of data from different parts of the country done by different researchers in different universities in Nigeria. And that cannot be taken for national data. It's a weakness in the system, and we need to try and close that gap.
Closing the gaps in Nigeria's healthcare system should be a priority for all.
In the healthcare system, there is a lot of disharmony among the team. So they are adding more to the problem within the healthcare system. Government, on their own part, needs to prioritize health.
The focal points of healthcare delivery in many countries of the world include safety, effectiveness, efficiency, and patient-centered care. Nigerians are looking forward to an improved healthcare system, and this can happen based on political will, upgrade of funding at all levels, and a more dedicated health workforce. Yomi Otaigbo reporting for Channels Television News.